Hello. Today we're going to simplify ADHD treatment.
Not the noise, not the opinions, just what actually works based on evidence and real clinical experience. We've seen many patients.
Oh, yes, absolutely. If you feel confused about ADHD treatment, you're not alone. Patients are often given fragmented information, and it leads to hesitation, frustration, and delayed care. This may be too many options, conflicting advice, medication versus natural approaches, lack of clear guidance.
So by the end of this, you're going to understand what are first-line treatment? How do they work? What are the role of non-medication strategies? And what actually leads to long-term improvement? And I'd like to talk with everyone about it's 20 years from now. I mean, yes, I want you to be able to function at work and function at school, but it's that life, right? That how are we going to be 20 years from now? And can we actually interrupt these cycles that keep happening in our families?
Let's start here. ADHD is not a motivation problem. It is a neurobiological condition, or as we mentioned before, it is a brain-based condition. That changes how we approach treatment.
So let's start. The first line treatment for medications are stimulants. And for those under 6, it's going to be starting with behavioral parent training, which I believe supports everyone at all ages, right? It starts with behavior, figuring out why it's happening, and I can go off on a tangent, but I won't. But specifically, the main stimulants are the methylphenidates and the amphetamines.
So there's two families.
Two families.
These include medications you've likely heard of. For example, you have heard of Adderall, Vyvanse, Ritalin, Concerta.
And there's so many more. So just because one doesn't work or you feel that you have exhausted all of the possibilities, no, there's always so much.
These are considered first line because they have the strongest evidence. They directly target the core symptoms of ADHD. The data shows medium to large effect sizes. That is important. Consistent symptom reduction with stimulant medications. There's improved attention and impulse control. Stimulants are first line because they work. This means meaningful, noticeable improvement for most patients.
And sometimes within 30 minutes. Or quicker. But this is where people get stuck, right? Medication definitely helps with focus, impulse control, but it doesn't automatically fix how someone lives their life, right? Their learned or ingrained habits, especially if you had 21 years before like we've had. So it doesn't help with organization, with emotional regulation. But this is what we're here to do, right? These are all skills that we can learn, we can build on.
Common side effects include decreased appetite and sleep issues, but they're mostly well tolerated. And they're usually manageable with proper care.
And it's important to consider, we'll talk about it in future models, is the appetite question. Sometimes people say, oh, they're not eating. Well, were they eating too much, right? Were we emotional eating?
Yes, as a baseline, were you overeating because you were managing your impulses? Not managing your impulses at all.
Yes. And in medical school, I would fidget with food, right? It's like, what
is the way to stay awake? We usually recommend make sure you drink water and that you eat for nutrition, even if you don't particularly feel like it.
Lean protein. All right. And then non-stimulants definitely exist. And sometimes people want to start with these, but they're typically second line. And many times we use them together. Other times we use them when the stimulants are not tolerated, are not appropriate, or even, as was just saying, not desired. And it is an individualized treatment plan. Every single patient deserves that attention to look at what are we trying to change, right? Always knowing the medication, we expect this. Are we finding that? Are we not?
Absolutely. This is critical. ADHD is not just a chemistry problem. It is also a systems problem.
This is where non-medication interventions come in. Yes, we're doctors, but we definitely see the benefits and believe in therapy, coaching, and structured support. Again, individualized care, right? We need to consider, do we need help? In school, at work, in the car, right? Over the phone. There's so many things. And how are we sleeping? How are we playing? How are we eating and play?
Physical activity is so important.
So important. And us adults like to play as well.
These approaches help with executive function, organization, emotional control, and consistency.
And the key difference, right? Medication improves capacity, the overall brain function. And I like these kind of little
working wheels.
Yes, the wheels. And coaching therapy is going to help build the strategies to improve the overall life and functioning. Right? We need We need them.
Sometimes you need the focus first so that you can actually build the skills that you didn't develop when you were little.
Absolutely.
The gold standard is multimodal treatment, not one or the other, both. You deserve both.
Yes, we do. Think of it this way. Medication gives you the ability to focus, and strategies tell you what to do with that focus, right? Because we can definitely focus on things that might not be supportive. Games or
Doom scroll,
shows.
social media, or people mention focus is like having water in a hose, right? You get the focus, but you have to point the hose in the right direction. Anyway, we can work on that later. In reality, without treatment, feeling overwhelmed, burned out, inconsistent efforts. Sometimes effort is good, but sometimes it's not there. And the inconsistencies causes a lot of issues. If we go with medication only, you will have better focus, but you can still be disorganized. If you combine treatment, it increases your chances of consistent performance, the way you want to show up in the world. In real life, this is the difference between struggling, partially improving, and actually functioning consistently. The consistency is the issue.
Yes, yes. The biggest mistakes, right, that we see are the extremes, right? Either relying only on medication, avoiding it entirely, expecting instant change, ignoring sleep or routines. It's the myths, the guilt, right? And for a lot of people, it's, I don't even want to go get evaluated because what happened, right? And I love asking that question when I'm evaluating, what if it's not ADHD? Right? And sometimes they didn't even think about it. They thought for sure it was. Or what if it is? What are you going to do with it?
See people that think, oh, I'm 45. There's nothing that can help me at this point. I'm old. There's always something.
Yeah, I'm still young. I'm almost
Of course. Here's the takeaway. The most effective treatment is evidence-based medication combined with practical, structured strategies. If you're struggling, the next step is not guessing. It's getting a proper evaluation and optimization and a clear plan.
Absolutely. Not just the meds.
Not just the meds.
This is where collaboration matters. Medical treatment plus behavioral support. You're not broken. You need the right tools, the right approach, and the right support, right?
The right support. It's very important.
Thank you.